I think one of the biggest things that works about the center is that they are really about empowering journalists and giving them the tools they need to do these important stories with the emphasis on health equity and how that impacts historically excluded communities and communities of color. And for me, as a journalist who really focuses on that, that's everything.
The types of stories that the Center for Health Journalism focuses on are some of the most complex stories that we are faced with as journalists in our society. It's things like homelessness, mental health, racial disparities in health, drug use and addiction. These are issues that are just laced with all sorts of political and moral and social baggage.
I think what's really amazing was just the enormous amount of knowledge that you walk away with. You walk away feeling a little like high, like a little like, wow, like, let's go. let's go get some justice. Like, that's how I truly felt.
It has been my privilege to be involved with the Center for Health Journalism for almost a decade now. In that time, it has been astonishing to see the caliber of work that fellows that have worked with the center have done, not just because they've won many, many national awards, but because the work that they have done has been transformative, both for the nature of health journalism itself and for the communities that they have worked to serve. The center has really led the way, I think, in broadening the definition of health journalism to look at the entire health of communities.
So we're not just looking at illnesses and medical reports. We're looking at things like the environment. We're looking at systemic racism and how does this play into the health of communities.
And that reporting is making a difference, helping to right wrongs with new laws and policies, to improve health outcomes, and to save lives. Journalism produced by news outlets in partnership with the center has led to congressional investigations, new resources, and new laws. The stories have brought policy attention to long overlooked community perspectives and paths to real change.
The center's mission is to empower journalists to do stories with communities and for communities, not just about communities, and to approach that with humility and rigor, with attention to facts, but also attention to who defines what a fact is, who defines what someone's experience is, or the best way to really tell that story. So our programs span everything from a 1-hour webinar to immersive programs. So we work for 5-6 months with the reporter, even up to a year, to really help provide a framework for the reporting built around this idea of health equity. Journalism right now is at a critical impasse. Journalists went into this field with hopes and dreams. Those hopes and dreams are still with them, but the resources to realize them are not there in a way that they used to be at one time. We're here to help fill that gap.
The impact of this fellowship is twofold. For one, it not only gives the journalist opportunity to work on the biggest project of their career, and it gives them that one-on-one time with a seasoned journalist that they probably wouldn't get any other time.
You're giving this established veteran mentor who you can just kind of spill all the questions that you necessarily wouldn't be able to do with your editors, whether it's because you don't want to bother them or they're working on a million other stories, that you have kind of like this, again, mentorship overlooking you, which is great.
I've been able to witness what that work looks like directly for the fellows as they're listening to the conversations, they're getting their training, and then taking that training and turning it into real substantial journalism that impacts their local communities.
Across the country, through multiple media outlets, I've sort of found this thread of reporting on traumatic issues faced mostly by marginalized communities. And I feel like I've built those skills with the USC Health Journalism Fellowships along the way.
I think one thing that the fellowship really helped clarify for me was the role of structural racism in these disparities that we see, and hearing a lot of different speakers who really helped the journalists understand how to explain that. I think it's really easy for journalists to make mistakes that sort of perpetuate some of the stereotypes, not meaning to, but this fellowship really helps to add a lot of the context.
The center's support was the game changer that made that podcast possible. When you're pitching something really ambitious and resource intensive, it's like nobody really wants to buy in until one person buys in first. And for me, that was the Center for Health Journalism. It was this group of journalists saying, yes, this project is worth doing. It was the center saying that made everyone else sort of believe in it.
Once I got the USC fellowship, I could then go to my editor and say, hey, I think this topic, at the time Black child mortality, is really important. I want to report on it, and I can do it with USC. They'll give us the funding.
Let's face it, right now we're in a time of deep partisan divides where it seems like we can't agree on anything. But the power of story can bring people together and help emphasize our shared humanity.
I think in this time where the journalism industry is really struggling and going through a lot of changes, the Center for Health Journalism has created a network and a community of reporters that have had similar experiences, that care about the same thing, and we can look back at each other's projects and see each other at these events and really connect about what the future of our industry could be and the values that we want to see reflected in our work.
Journalism is hard, and the stories that we're telling are heavy, so having a cohort that can support you is really helpful to keep doing the work.
As one of the participants in our program put it, the Center for Health Journalism is a harbor in the storm.
The legacy of the center is being able to provide chances for people who don't necessarily get opportunities. And it's not necessarily because of the lack of talent, but it's just because sometimes our backgrounds or our stigma of who we are or where we come from may not fit what the journalism, photojournalism world looks like. And the center does, I believe, a good job in dismantling that narrative.
They are doing the foundational work that this industry has needed for a very long time.